friends, welcome to Easy Nurse, where nursing education made easy. So in this session, let's discuss regarding the first year post-basic BSc Nursing Foundation, the most important and the definitely appearing questions for your upcoming exams. So let's get started. Coming to your first question is regarding the primary health care. This will be usually asked for a 5 marker and it can be clubbed with other questions for 10 markers. So let's see what is the definition. It is a care, it is given in the first point of contact in the healthcare settings. So once the patient enters a hospital, the first point of contact, whatever care we are giving, that's called as a primary health care, and offering the essential health services, for example, prevention of the disease, diagnosis of the disease, and treatment is done in the primary health care. So here it is focusing on accessibility. So patients should be accessible to the care. Continuity of the care is taken care, in the sense just not caring in the initial times and do not continue the care until the disease has been clearly cured off. So for example, if the patient has been deceased, the primary care is given and continuation of the care should be done until the disease is completely cured. Next is it's addressing the majority of an individual's health needs. Whatever is the need of the patient, that should be taken care under the primary health care. So what and all they are focusing, what are the different services they are focusing in the primary health care is one of the important topics. Firstly, the health promotion is taken care. They are educating and empowering the individuals in order to improve the health and prevent the disease. So you need to educate the people and they have to know about the disease, and also prevention should be given, the education should be given to the patients regarding how to prevent the disease. Coming to the second is disease prevention, as we just told. How do you prevent the disease? With the help of vaccinations, and a frequent screening should be done in order to identify the disease. Firstly, health risk assessments in order to prevent the illness is one of the main steps. Coming to the next is the curative care. How do you cure? So you're diagnosing and treating for the common illnesses and health conditions. So you're diagnosing what is the condition, you're treating it for almost all the common illnesses which is occurred and health conditions which is usually occurring. Coming to the next point or the next service that they are mainly keenly looking at is the maternal and the child health. So these are kind of vulnerable people. So prenatal care, childbirth services and child health monitoring is taken care. That is one of the main good services that the primary health care is keenly looking at. Coming to the next service is the family planning. Here they are counseling and giving the provision of the contraceptive methods, how to use the contraceptives and what is the use of it, how you can make sure the population explosion is not happening due to these contraceptive or the family planning methods. That is being educated to the parents. The next is the mental health care, the basic counseling and management of the mental health conditions is done under the primary health care. So they are also providing the mental health care under the primary health care services. The next service is the rehabilitation services. Here they are supporting the individuals from recovering from the illness and also from the injury. They are also making sure they are learning the skills for their upcoming day-to-day life, to lead their life. The rehabilitation, the skills are being taught. And the next is the immunization programs. Here, they are vaccinating to protect against the preventable diseases. Certain diseases can be prevented prior to their occurrence and hence they are vaccinating the people. And the next one is the nutritional services. They are giving the guidance on the healthy eating and treatment for the malnutrition. So basically, what is the food that is much healthier to you? They are educating them regarding it, and also they are making sure there is no malnutrition in the people. And the last service is the health education. They are giving the information on maintaining a healthy lifestyle and also managing if they are having any disease conditions. So these are the different services that the primary healthcare is keenly looking on to. So let's move on to our second question, that is the nursing process. One of the most important questions, the nursing process, it is a systematic patient-centered approach. So the patient is kept in the center when we are giving the care. All the needs of the patient should be fulfilled. So they are using the nurses to ensure the quality care when they are giving the care. The quality should be there, involving the assessment. So how do you maintain the quality? By following all these steps: the assessment, diagnosis, planning, implementation and evaluation process, by which a good quality of care is given to the patients. And this nursing process, it's a repetitive process. So it's not just that you're finished with all these 5 steps and again if the patient is suffering, we are not going to repeat it. It's just that a repetitive process. It is aiming to identify and address the patient needs and also the outcomes effectively. So one symptom of the patient has been cured, but the patient is developing another symptom. So we are again repeating this process in order to give the quality care. So let's see what are the different steps of nursing process. The first step is the assessment. Here you're collecting a comprehensive data, a complete data about the patient's health status through what processes: observation process, interview process and physical examination processes. The complete data of the patient is being received through these 3 processes and we are getting the information about the patient's health. The second step is the diagnosis step. Here you're analyzing whatever data you have collected, you're analyzing the assessment data, you're rechecking it, you're identifying the patient's health problem and also you're formulating the nursing diagnosis. So basically you're identifying the patient's health problem with the help of this assessment data. That is the diagnosis process. And the next step is the planning. Here you are developing a care plan with a specific goal and the outcome. So certain care, how we need to give the care to the patient, that planning is done in the planning step. So you are also checking for what might be the outcome after giving this kind of care. So you are determining the interventions required to address the nursing diagnosis. So we need certain outcome. We need to make sure the patient is much healthier before leaving the hospital. What kind of care we are planning for the patient. So that is the planning process. The next process is the implementation process. So whatever we have planned, you are executing it. You are bringing it into the action in the implementation process. You are executing the planned interventions in order to achieve the desirable outcome. Our desirable outcome is the patient should be healthier. So ensuring you are providing appropriate and the safe care. When you are implementing the care, you should provide a safe care to the patient. And the final step is the evaluation step. Here you are assessing the patient's response. So once you are giving the care, the patient can show positive or the negative response. So you are assessing it. You're doing the interventions, you're determining if the goals and the outcomes have been met. In the sense, as we know, we need to make the patient healthier. That is our outcome. If in case certain situations the patient is not showing any progress, then you are again going back to the planning process. You're planning, you're changing your plan of giving the care and further you're implementing it and again you are evaluating. So these are the most important steps of the nursing process. So let's move on to our next question, that is the quality assurance. What is this quality assurance? It is a systematic process. It's also a systematic process of ensuring the products or the services. For example, we are using certain products or the nursing care is also a service. The services and the products that is meeting the established standards and requirements. There are certain set standards and requirements for the services and the products, whether it is meeting these standards or no. That process, the systematic process of checking, is called as quality assurance. So here it is involving continuous evaluation. So if a person is being continuously evaluated, his progress towards each subject what he's studying will be much higher. He'll be progressing very fast. So a continuous evaluation, monitoring and improvement to maintain the consistency and reliability in the outcomes increases if we are continuously evaluating, monitoring, etc. So this is called as a quality assurance. So let's see what is the role of the professional bodies in maintenance of the standards. There are certain professional bodies wherein which they are maintaining the standards. How they are maintaining? What is their role? So let's see into it. The first point is setting the standards. Prior to evaluating, they need to set certain standards. So after keeping that into a point, only we can do the quality assurance. So first point is you need to set the standards. The professional bodies, they are establishing the guidelines, as I told you, rules or guidelines and best practices for quality and ethical conduct. So they are setting up the standards, certain guidelines through which how you can give the care, what and all should be followed when you're giving the nursing care. That is the setting up of the standards. Coming to the second point is the accreditation. What is meant by accreditation? They provide the certificate or licensing to ensure the professionals they are meeting the required competencies. So for example, as I just told you, they are providing certain certification and licensing if in case all the standards have been met or all the guidelines have been met. So for example, we have already seen the adulteration process. So adulteration in the sense mixing up of non-quality goods into a good good and making it much higher in the quantity. So this kind of adulteration is seen. If in case of these conditions, quality assurance should be set in a good standard, and if they are meeting those standards, then the certification or licensing is given by the bodies, the professional bodies. So that is called as accreditation. They are providing the certificate or licensing to make sure the professionals they meet the required competencies. So the next role is the continuing education. They also should give the facilitated ongoing training in order to keep the professionals updated on the new developments. There are certain new developments that occurs in each field. So make sure they are kept much updated. They also have to go ongoing training in order to keep them, have a knowledge regarding the updated developments. So that is also one main rule. The next role is the ethical oversight. Here they are ensuring the adherence to the codes and conduct and also addresses the violations through the disciplinary actions. So if they are not following the set guidelines, codes and conduct which has been given through the set standards, if they are not following, then they are also punishable. So they should take certain disciplinary action on people who are violating those guidelines. That is also ethical oversight. The next one is advocacy. Here they are representing the professional interests in policy making to maintain the industrial standards. So they are advocating on behalf of these kind of professionals. Here what they are doing, they are representing the professional interests in making the policies. And the next step is auditing and evaluation. They are conducting regular assessment. As I just told you, the continuous evaluation is necessary. Regular assessment in order to ensure the compliance with standards and regulations. All the regulations are met. All the standards are met or no, they are evaluating. And the final step is support and resources. Here, they are offering the guidance, resources, whatever is required in order to smooth running of the institution and the services. Next is tools for professionals to maintain the high standards. Whatever is the requirement of those professionals in order to maintain the high standards, they are providing it through the support and giving them with good resources. So these are the role of the professional bodies in maintenance of the standards. So this is also one of the most important question which might be usually asked for a 5 markers. So let's move on to our next question, that is the importance of records and reports. So let's see firstly, what are these records and reports? Records are the organized and structured information which is usually kept for reference or for the future use. Often it is maintained in a systematic manner. So for further use, we need certain information which has been recorded. So that is called as organized structured information which is kept for reference and for future use, and it has to be maintained in a systematic manner. Those are called as records. Coming to the next one is the reports. These are the documentations that is present in the information. So they are also giving the information, findings, summarizing the based on data as well as analysis or investigation. Certain investigation like blood reports, we say it as blood reports. So it is giving us certain information, the findings, and summarized based on the data analyzed. So these records are typically formatted for the communication process or for decision making purposes. So these are called as reports. So let's see what are the importance of these records and reports. Firstly, it helps in documentation. As I just told you, they provide a detailed account of the activities, what you're doing, the decisions if it is necessary. That also is based on these reports and records, and transactions, whatever has happened, it has a documentation. It acts as a document. The next importance is it acts as a evidence in severe cases, or it serves as the evidence of compliance in the sense. So for example, if the patient is having a cancer, so that can be identified with the reports which the patient's reports is coming. So according to that patient report, the doctor is making a decision saying that he or she is having a cancer. So it acts as an evidence if the doctor is giving certain treatment to the patient based on those reports. So the decision making is done according to the reports of the patient, and the doctor is showing it as an evidence. So it acts as an evidence, transactions and legal obligations through which it is acting as an evidence. So that is the second importance. The third one is decision making. It is facilitating. It is acting as informed decision making based on the accurate data and analysis. As I just told you, the doctor is giving the treatment based on the reports of the patient. It is acting or it is helping in the decision making. The next importance is communication. Also, it enhances, it improves the communication within the institution or the organization and also outside the organization. The next one is accountability. It supports. So whatever kind of care that I am giving to the patient, we are recording it. So that acts as a accountability. These are the work that I have done within this much period of time. So it is supporting the accountability by documentation of the responsibilities and the actions that we are performing. The next importance is analysis. It is enabling the trend analysis, forecasting and performance evaluation. You can evaluate the performance of the nurses, whatever they have documented according to the whole month, whatever they have performed, the actions that they have done, that has been recorded, and according to that you can see, you can evaluate the performance of them. And the next importance is the legal compliance. It is helping in meeting the regulatory and legal requirements of the institution. And the next one is the historical performance. It is providing a historical record for learning from past experiences. So past, there are certain records wherein which you can study that, and for further it will be a reference for you. You can take that experience, the past experience, and you can learn from it. So the next importance is transparency. It is improving the transparency in operations and outcomes. So whatever function or whatever action, whatever care you have done, you're recording it. It is very much transparent in through with the help of these records and reports. And the last importance is planning. You are supporting the strategic planning and resources allocated based on the data-driven insights. In the sense, whatever kind of planning it's there in your mind, you're recording it. Accordingly, you can give the care. So these are the most importance or the most important points regarding the records and the reports. So let's move on to our next question, that is biomedical waste management. What is this biomedical waste management? It involves the proper handling. How do you handle the waste? How do you segregate the waste? How do you treat it? And how do you dispose the waste which is generated during the medical activities? So whatever waste, it is handled, how it is segregated, how it is treated and disposed of these kind of medical activities, the waste is being produced. So how do you do these processes in order to prevent the harm to the humans, animal and the environment? So this process of handling, segregating, treating and also how do you dispose this waste is called as biomedical waste management. So let's see, it also ensures the compliance with the safety regulations. So there are certain following set rules or procedures of maintaining these kind of wastes, or how do you process this. So there are safety regulations for this to minimize the health risks and environmental contamination. So this process, the whole entire process is called as biomedical waste management. So let's see what are the different steps which are involved in this biomedical waste management. The first one is segregation. The waste, it has to be separated at the source. Wherever the waste is being generated, over there itself the segregation. Which type of different wastes are coming? How to segregate it? It should be segregated at the place where it is being generated. It should be segregated or separated at the source into the categories like sharp, infectious and non-infectious materials. There are different types of waste. Accordingly, we need to segregate at the place where it is being produced. The second step is color-coded bins. Specific color code. As I just told you, there are different types of waste, and for each type of waste, there are color-coded bins. For specific colored coded containers like yellow for infectious, red for contaminated waste, etc. These are just examples. So according to that, we are segregating it, and it is and they are used in order to prevent the cross contamination. It should be done in order to prevent the cross contamination. So the third step is collection. The waste is collected regularly by our trained personnel. Not all are going to collect this waste. Only a trained person should be regularly collecting to minimize the exposure and the health risk. They know how to collect the waste. There are certain, precautions taken by those people, and regularly only the trained personnel are going to collect the waste. And the next step is storage. The biomedical waste that should be stored temporarily in secure, marked areas before the disposal. Before we dispose it, it should be securely placed in a proper place where marked areas before they are disposed, ensuring no environmental contamination is occurring. So environmental contamination should not occur. That's the point in which we are storing it in a proper place prior to disposal. And the last step is transportation. Specific vehicles, they are transporting the waste in order to treatment or disposal sites wherein which we are adhering the safety regulations. Along with the safety, making sure only proper vehicles, special vehicles, they are transporting the waste into the treatment area or to the disposal sites. So these are the important steps. So the next step is the treatment of these waste. How do we treat it? With the help of autoclaving, incineration, chemical disinfection, they are used to treat the waste, rendering it in a safe manner. So safely we are treating these wastes in these different steps. It might be autoclaving, incineration, chemical disinfection, etc. So the next step is disposal. After the treatment process is finished, the waste will be either incinerated, buried, or safely disposed of in the sanitary landfills. So it might be buried or it might be burned or incinerated safely under the landfills. This is about the disposal process. And the next step is regulations and compliance. This is very important step. The biomedical waste management is being usually governed by strict laws and guidelines. So they are ensuring the public and environmental safety. Wherever there is residential areas, these kind of treatment and disposal is not possible. So they are managing it in a proper, safe manner. Strict laws and guidelines are maintained for the regulations and compliance of this biomedical waste. And the last point is training and awareness. The healthcare staff, they should be usually trained regularly on a proper biomedical waste handling. So how they are segregating, that should be taught to the most of the healthcare staffs. Also, they need to know how to dispose these kind of wastes. So we need to give them proper training and awareness regarding the segregation and disposal of the wastes. So as we just saw, there are different color coded bins. First bin is the yellow bin, wherein which the human, animal tissues, body parts, soiled wastes, expired drugs are put into the yellow coded bin, yellow color coded bin. And the next one is the red, wherein which contaminated waste like the tubes, catheters, gloves, they are segregated under the red bin. And the next one is the white or the translucent bin. Here sharps including the needles, scalpels and blades are being segregated. And the last one is the blue one, where the glass items, the glassware, broken or discarded medicine vials are being collected. So these are the color-coded bins. So next we move on to our important question, the nursing audit and its process. What is meant by nursing audit? The systemic evaluation of the nursing care quality. What kind of care we are giving and the quality of care is being evaluated. And the documentation, whatever we have done, is it properly done? And the outcomes by reviewing the patient records and care processes, they are evaluating the nursing care, and that is called as nursing audit. So how the care is given, what kind of quality of care, and also by reviewing the patient records and reports, they are getting to know if the patient outcome, whatever outcome we have planned, is it fulfilled or no. And it helps in assessing the compliance with standards and identify areas of improvement in the patient care. So if in case this kind of quality of care is not given, the patient improvement is not seen. So that is how they are evaluating. So let's see what are the different processes it is involved in this nursing audit. First is preparing for the audit. They are establishing the audit team. Team members are formed, defining the scope. What is the scope for doing this nursing audit? And developing an audit plan, outlining the objectives and timelines. What and all should be done by these audit team members. The objectives and timelines are given accordingly while in the step of preparation for the audit. And the next step is selecting the criteria. Here you're identifying the relevant standards and benchmarks. There are certain set guidelines and standards and the benchmarks to measure the quality of nursing care. How do you measure it? Certain guidelines are given, and based on the best practices and regulatory guidelines, they are selecting the criteria for the nursing audit. And the next step is measuring the performance. They are collecting and analyzing the data from the patient's records. As I told you, from the records of the patient, they are analyzing, they are evaluating, checking through the observations and staff interviews also they are performing to evaluate the compliance with these selected criteria. As I told, the selected criteria, according to that, they are evaluating. And the next step is making the improvements. They are identifying what are the gaps, why these qualities are not maintained. If in case it's not maintained, what are the gaps in the care, and develop the action plans. They are also giving the resolution for that gaps, and they are addressing the deficiencies. As I told you, what is the deficiency in giving a quality care? Ensuring involvement from the nursing staff and also the management. So they are involving the nursing staffs, the management people, in order to identify the deficiencies and try to improve it. And the next step is sustaining the improvement. So improvement should be sustained. So hence they are implementing the changes and monitoring their effectiveness. They are making certain kind of changes in the nursing care in order to make sure improvement is in progress, and through ongoing training. So training is also necessary, feedback is taken, and support is given to maintain high quality care. So once you are taking ongoing training, you get much more knowledge regarding the quality of care that you can maintain. Feedbacks are taken from the patients and support is given in order to maintain a high quality care. And the final step is re-audit. After making sure all the improvements are done, re-auditing, re-evaluation. So conducting the follow-up audit in order to assess the impact of the implementation changes and also to ensure continued adherence to the establishment of the standards. They have to set new standards and new guidelines and also improve the quality of care with the help of regular follow-ups. So these are the steps that are involved, or you can say the process that are involved in the nursing audits. So let's move on to our final important question, that is expanded role of the nurse, which is usually asked for a 10 marker with the club of another question. So let's see what is the expanded role of a nurse. Firstly, the patient care. They are providing the direct care to the patients, including the administration of the medications, monitoring the vital signs, assisting with the daily activities of the patient. Secondly, they are providing education. They are educating the patients as well as the family members about the health condition of the patient, treatment plans, what we are planning for them, and the self-care strategies, how the patient can do their own self-care. That strategies they are educating to them as well as the family members. And the next is the advocacy. They are acting as a patient advocate. They stand with the patient in order to ensure their needs, whatever they need, the preferences, what they are preferring, as they are respected within the healthcare system. They are being given with complete respect within the healthcare system. They are standing on behalf of the patient. And the next one is care coordination. So they are collaborating, they are clubbing along with the doctors, other healthcare team members, multidisciplinary team to plan the care, to coordinate the comprehensive patient care. A complete overall care to the patient is given while clubbing or collaborating with the multidisciplinary team members. So the next step is they are acting as health promoters. They are promoting the health and wellness through the different community outreaches. They are going to the community and giving the care. They are performing the educational programs and preventive care initiatives they are taking. How to prevent the diseases, that kind of initiatives they are taking. And the next is they act as research participation. So they also involved in the research participation, engaging in clinical research where they are contributing to evidence-based practices and improve the patient outcome. They are further learning more regarding the patient outcomes and they are improving the how to give the care for the patient. So the next step is the leadership. They are taking on the leadership roles in managing the nursing team. They are guiding the staffs. They are influencing the policies, and also they are practicing the improvements to the care that they are giving. And the next is the quality assurance. As we just discussed, they are also involving in the quality improvement initiatives. They are involving in the audits and adherence to safety and regulatory standards. There are set standards and guidelines. They are adhering to those standards and guidelines and giving the care. And the next is technology utilization. They are using the healthcare technology and informatics to ensure patient care and streamline the process. So they are using certain different types of technology in order to give the healthcare, which is making them their work much easier when they are using these technologies. And the final expanded role is mental health support. They are providing an emotional support and counseling to the patients as well as the families which are facing the health challenges. So they are making them mentally healthy, the families as well as the patient. So these were all the most important questions which is much more arising for your upcoming exam. For more important topics and questions, follow Easy Nurse. So stay tuned to Easy Nurse. Thank you.